Wayne. Well, we're taking action for your health, and Dr. Joe Mollet is joining our action team now to help. Dr. Joe, you're here to talk about different things. Your practice is dedicated to the prevention and education of addictive disorders.
That's correct.
First of all, let's introduce you to our viewers. Tell us about your credentials and what your focus is.
Okay. I am licensed as a physician and surgeon in the state of Pennsylvania. I trained as a general surgeon at Temple University, and then went to work for a time at the Florida Medical Association, working with problems of addiction that manifest in other physicians. Mm-hmm. I'm board certified in healthcare management, and I'm presently the executive director of Healthcare Connection, which is a drug and alcohol rehabilitation center that works with impaired professionals specifically.
And here in Hillsborough County?
Here in Tampa, correct. Mm-hmm. Healthcare Connection of Tampa. And I'm also a certified medical review officer, which means that the federal government recognizes that I can work with drug-free workplace, mm-hmm. policy, etc.
When you say addictive disorders, mm-hmm. exactly what are we talking about?
We're talking about the type of problem that we see quite frequently in the news. You had a piece on earlier about a person driving under the influence and mm-hmm. hitting a house. We've heard about the problems of Noelle Bush.
The governor's daughter.
The governor's daughter, writing prescriptions, etc. Those are all a constellation of disorders that relate around substance use and abuse, and really are a whole spectrum of problems. Mm-hmm. All of this, of course, has a lifestyle orientation to it. Mm-hmm. Much of what we do normally can be dangerous, and we don't really understand it, or as individuals in the public, we don't recognize, for example, that dietary concerns, use of alcohol and tobacco, maybe some exercise behaviors can potentially be dangerous. Right. We work in a society where workaholism is rewarded.
Yes, that's right.
And so many times what addiction really is not recognized as a problem.
When you as a physician would see it
as one. That's correct, yeah.
Okay, well, these are all things we'll be talking about in the next few weeks. Of course, the segment wouldn't be possible without the input of viewers, so we want your health questions. You can send them to the station. Ask Dr. Joe here at ABC Action News. The address is 4045 North Himes Avenue, Tampa, Florida, 33607, and you can also go to our website at abcactionnews.com. Patrick, back to you. Thank you, Wayne. We've all been watching the drug case involving the governor's daughter, Noelle Bush, and the charges against her for trying to get her hands on illegal prescription drugs. But the question begs, here's a girl with everything. How can the daughter of one of America's most influential families with money, notoriety, end up on drugs? And here to give us some insight on cases like this one is Dr. Joseph Mollet. Thanks for coming in. This is really a frustrating one. She's got all the money she needs. She can study whatever she wants. She has all the contacts that she needs to get a great job, and yet here she is in a drug rehab house.
Yep. Well, it really, this is really the question. How does that happen to somebody who seems to have everything if use of drugs and alcohol is really a moral issue or has something to do with environment? The reality is that after 10 years of research, we know conclusively that addiction is a brain-based disorder, that it comes from an illness that centers in the brain, and particularly a part of the brain that doesn't involve logical thinking. It involves the part of the brain that deals with emotions and feelings. So, mm-hmm. for example, what I mean by that is if you feel thirsty, you can't think your way out of that. Mm-hmm. If you feel hungry, you can't logically think your way out of that.
And you're saying that's what folks in that position have?
That's right. I'm saying that this is a medical illness, which...
But why are some of us able to say no to those feelings, those urges that we have, and others say yes?
That's exactly the question. And the answer is that people who have addictions have a mismatch of chemicals in their brain. They're getting a message that says, I need this, mm-hmm. and that's abnormal.
Well, here's what a lot of us think when we see stories like this, and I'm not talking specifically about the governor's daughter, but the rich kids when they get in trouble. Right. The parents did something wrong. They weren't paying attention. Right. Is that the case in the patients that you see?
That is not the case.
It's not.
In point of fact, the single most important factor in drug addiction and alcoholism is genetic predisposition. Now, that doesn't mean that a certain injury due to exposure can't happen at some point during your life where you're exposed and the chemicals make an alteration. Mm-hmm. But the reality is that the reason that, for example, Noelle Bush is confronted with jail time and still doesn't seem to be altering her behavior is that that consequence is not helping to normalize her problem.
Well, we'll talk more about that when we visit with you again on Wednesday. Okay, so hold that thought.
I will.
Of course, the segment would not be possible without your participation at home. We want your health questions, so please send them to us. Ask Dr. Joe here at ABC Action News. The address is 4045 North Himes Avenue, Tampa, Florida, 33607. And you can also ask Dr. Joe. We're continuing our discussion on drug treatment. Joining us is Dr. Joe Mollet, of course, of Healthcare Connection. The last time we visited, we had the first question from a viewer. We've received another question from a viewer who wants to know more about addictive personalities and alcohol use.
Before I answer the question, let me just say that I'm going to be answering all of your emails. Your email questions have been very perceptive. I'm going to be answering them personally. Lots of people are concerned about confidentiality, which is important when you're talking about drug and alcohol addiction problems. The idea of an addictive personality, to answer your question, is a dated concept. It used to be thought that a personality would predispose someone to developing an alcohol and drug problem. What we know today is that the neurochemical problem manifests itself in certain behavioral characteristics. For example, somebody who is predisposed to drug and alcohol problems would probably be compulsive in other areas also. They would have feelings of insecurity and discomfort in areas where other people feel normal. The code for that is that they feel restless, irritable, and discontent at times when other people feel normal. Going to a high school dance, interacting in social occasions where most people would feel comfortable, they feel uncomfortable. When they drink and use, it makes them feel comfortable in those environments.
Or it makes them more relaxed, they say.
Exactly. And so it's really a pattern of self-medication more than the kind of substance abuse that we imagine it to be.
Okay. Well, there's so much pressure now on young kids to be socially cool.
Yep.
Are you finding that the kids are younger and younger when they're turning to drugs and alcohol?
That's absolutely true. And what the problem that causes is that this culturally determined pattern of substance abuse then increases the likelihood that people who are predisposed to this problem will be exposed to the mood-altering substance and then develop a full-blown addiction.
When you say predisposed, most people don't admit or don't see that they are predisposed.
That's correct.
What do you do at that point?
Well, unfortunately, the state of the art presently is to not do anything about the problem until the disease actually manifests itself. In other words, you go to drug treatment after you get your DUI. Right. You go to drug treatment after you get arrested for possession. We would hope that the state of the art would develop to where we could identify those kinds of issues. For example, a fair number of children who have ADD, ADHD, attention deficit, hyperactivity, those problems actually predispose to drug and alcohol problems in the future if they're not treated and dealt with at that time.
So parents really need to take that seriously,
Absolutely.
even if the child is 5, 6, or 7.
That's correct.
Okay.
And there's now non-pharmaceutical ways of dealing with those problems, like EEG biofeedback, for example. We can talk about that another time.
Yeah, we'll do that then. Thank you.
Great.
It's very complex.
Yes, it certainly
We'll give
is.
you more time next week.
Okay.
Thank you, Dr. Joe.
All right.
If you have any questions for Dr. Joe, you can mail them to Action News. The address here is 4045 North Himes Avenue in Tampa. The zip code is 33607. Or you can also visit our website and email them to him, abcactionnews.com. Pat?